From there, we will determine if there are enhanced or other measures needed to reduce the risk of another outbreak. In addition, due to increasing cases of COVID-19 in the South and ongoing concerns, beginning October 5th, all exempted workers traveling to Nunavut will be required to wear masks when outside their dwellings. Thank you.
Nuat sila tilugin aluna sila tutako hanuk kanyak malitaw yalin ni akit siya kala mga ta ulugan naktume hunagit siya magundang ningano hakan ninga gutako amisok ngopanleaning in Nunavut
And I should clarify that that's for the first, they need to wear the mask for the first 14 days after arrival in territory.
Ken Driscoll, APTA National News. Dr. Patterson, the thing you were mentioning just at the very end about the exempted workers and the masks, wasn't it like that before? I'm wondering, what were the rules about the exempted workers? I was under the understanding that they did have to take certain measures. Was masks not one of them?
Ken Driscoll, APTA kunnik luta Patterson tako piyarilap tiluto house kakataka bitako yakanayak tikigunnak ditaw si mayo matuak si mayo naraham ningin nut. Kanutaman nato agaw watay katalangin mata.
The wording was less clear. For healthcare workers, we were definitive that if you're at work, you wear a mask. For other workers and in other situations, it was more of when distancing can't be maintained, wear a mask, and that was hard to enforce and created confusion and still led to some situations that could have been risky. So we've just made it a blanket statement that if you're an exempted worker and you're out and about, whether at work or whatever, wear a mask for the first 14 days.
Tukisinat siya lang yung mata, tukisinat tigyan tituin na si Mayo tako, ato yung nakatagaya kalaw tugalo, matuanik ikanayak sutik, asiminilo kanayak hatimini, kanit sa niya to ako ti, ato yung nakatagaya kalaw to, matuanik. Taman na naluli ko tao si Malaw nga, taman na ulo kaya naktumila, kayo tao si Katalaw nga, tayo may mat, nalunap tao si Matsya, makilok to tako, angit tao si Mayo, kanaya kaya kung nak si Mayo, tayo ma, ato yung nakatagaya niyaliraya nga, ulo na 14
Queen Amik for the interpretation. This is, Dr. Patterson, this is the first time you've sent out the rapid response team where it turned out there were actually cases. You had a dry run in Pond Inlet with false positive. Have you been able to learn anything about how that team's going to operate in the way if it does hit a small community? What have you guys learned from this TMAC operation?
Dr. Patterson, sibulla pami dako tuawan nakto kayo reakto itako sibulla pami naluna tayo yo hatilogo tay na tamma ko tawlaw si mamma mitsi matalim ni kisiani ulumi mulle kano ilit si mavisi kano nunalin ni mikiyo taw na sanita man nawala na kakayang mga.
It's too soon to say. Right now they're very much the focus is operational, doing the test, trace, and isolate mechanism or mode, and after they wind down, then we'll go through the documentation and try to capture all of those lessons learned and then fine-tune our process from there.
Man nakila mi ulo akto taman na kausari kaswara nga kisa nito kaga khalari hatang ata kawai sakta ulo lutik malukik kun ne katis yumini mga ta kawai sakta lekut inutuga hakti taw talekut kisa ni ta ko pia ga palala tilugi te man ta ko no ala ka bukisuli ma to kisiga ko tiyo yo tamak ko nalo na ira kaner lugi khano ili ko ti pala na mga atigo.
Jackie McKay, CBC News. The rapid response team at the TMAC mine, will they have to isolate once they leave that mine?
Jackie McKay, CBC pivalia yo connect ko khila mi yo kayo reactor yo TMAC ko yo na be mo si mayo utiqqata anittailigaahartitaulaaqqat.
Yes, they'll have to isolate at home for 14 days after they leave the mine.
Inutugiaharniartu anittailigaaharniartu ulluni 14 ni ujararniarbimmiingaalaurtillugin.
CBC recently spoke to a woman staying at the disco who had an exemption to not isolate to come here to see a dying family member, who expressed concern about being able to wander through the community. Can you say exactly what mechanisms are in place to ensure that people who have exemptions are following their rules?
CBC uqaqatiqarsimamma tuyormivimmiittuminermi discovery mi isumaaluutiqarnerassuni taanne qanayarti tikititaussimajoq angertausimalluni atuqattaningimma matuammi qanu taakkua maligiaqallarittanginni qanu malittauqqartauqattaqa tamaungat angertauqattartu qanayariartu.
Right now, when you go through the process, you fill out the application, you sign the agreement that you will not go outside of your house, outside of those required times like for work, and it's complaint driven. So when we get communication that somebody has been isolated and is not following the rules, we follow up with them to remind them about the obligations, and on at least 2 occasions we've had RCMP visit people to deliver warnings, and we're working on enhancing the enforcement process. I'll let Uli translate.
Maannau jotakkua pigaalitattillugi tatatisqaariaqasuungummata tutsirautimini tamaunga tikigumannerarsutik atiliurearrattangata imaang angerneraarsuti taakkua aniqattajaanginnerarluti angeqqaminni tamanna kiseana unnerluttuheeraimma taimaa qauisarunnakannersiqattarunnartugu tamakkua inuttu anittailigaartitauju malingittumini utillugit qaujikkartaugiarrattartu iqqaititaulluti kisuni maligiarrammangaata maqquarti palisikkunni upattitsigaarrattarsimajugut uqaujigiarturtitsilluta tamakkua malitsiaqullugu malittauqujausimayuni.
Mathieu Servet, Radio Canada. Can you clarify what criteria are used to determine that a case is reported in Nunavut?
Mathieu Servet, naalausarjikkunni CBC kunni kisuni atuaqartaqareaqattamakkua Nunavut-muurtuqarniartillugu.
Yeah, this is a little bit confusing. There's, in the formal national reporting system, the main thing, or one of the main things, is to ensure that no case gets missed. So every case of confirmed or probable COVID-19 gets reported to the national data set, and ideally no case gets reported twice. And the way that we do that is what are called rules of attribution, which jurisdiction reports the case. The rules are designed to help determine that. I'll let Uli interpret that part and then get into the details.
Tamanneila nalunagalamma nalleani nalunertaussimakattarniarmangaata nalleani avittorsimaviujuni kiseani kanatami nalunersiqattartu tamakkua malittaugialinni qanu maqquarti nalunertaujuqarrunagu nalleani avittorsimaviujuni taakkua nalunertauginnahattareeli kanatalimaamu turaangajuni kiseani atuagaqarillutik nalleanu turaangatitaurniarmangaaq atuagartaharmimma malittaugialinnik qanu namilo nalunertaussimanearmangaa nalleani avittorsimaviujuni.
The rules have changed a little bit over the last 8 months from time to time, and right now most cases are being reported from the province or jurisdiction where the person permanently lives, but there is a clause that in the rules that requires some discussion between the jurisdiction where the case occurs and the jurisdiction where the individual lives, and some back and forth on that. And as long as both jurisdictions are clear on who's reporting, it's acceptable. In the case of the one Nunavummiut who contracted COVID-19 in the south, that individual had been there for 6 weeks, I think, when exposure and transmission occurred, so it was reported in that jurisdiction. What's going to happen with the individuals at the Hope Bay site, I don't know yet. That's to be determined.
Tamakko ato agaya sitsukpalle asima matatakkiu sima yoni pingas sitama oyok tuni mana oyok tamakko nuvajuanak to kaktaw nuvajuanak na kaktaw yulima avitok sima vio yuni khallunani naluna taw sima khattaktut amma tamakko ato agarni naluna taw sima luni ta ko khawi yaun nekhat tabani nunaging ngitangani nuvajuanak ta tumini uluni nunallaqingani naluna taw sima nga khattameyut tamakki avitok sima vio yu tukisiu makhatigi ito akhatik taanali Nunavummiu tainna khallunani nuvajuanak taalaorsima jo khallunani ilaorsimammat pinasaaqussirni 6 ni taunani ilaorsimamma taunani khallunani nuvajuanak naasaqtaussima ngaalaorsima jo taanna Hope Bay pipidjutigillugu suli khawjamangitavu nami nalunaattaussima niarmanga nalliani avittorsima viujimikkanatami.
Regardless of how all the attribution gets finalized, the important thing is transmission and acquisition of COVID-19 has occurred in Nunavut, and we're responding to our first outbreak that at least started partly in Nunavut.
Taana pidjutigillugu nalunaattaussima khattarnaamanga nanlianu avittorsima viujuni naasaqtau khasiutiluni tamakko seammartauni qat ubbalu nuvajuanak taane qatamani Nunavummi naasaqtau khasiutigayartu taana sivullerpaami searmarni uvalliama tamani Nunavummi.
So does that mean that you don't know yet whether you'll consider that those cases will be reported here or in the province of residence of the employees?
Suli haujamangilati tamani Nunavummi naasaqtau khasiutiniammanga ta ubbalu khallunani avittorsima viujuni naasaqtau ngaarsima gayaqqa.
No, we don't know yet. The decision will be made between or after discussions between our team of epidemiologists and their counterparts in each of the home jurisdictions of the people who have positive results.
Haujamangittugu suli tamakko uqaqatigigutaunartu tamanna Nunavummi ngaarneqartaunarmanga ubbalu angeqqangani avittorsima viujuni khallunani taakko searmartulirinnermu piliriqatigit tamani Nunavummi tambalu khallunani atuni avittorsima viujuni uqaqatigiinniartu taakko nami naasaqtaussima gayarmangata.
Megan Dooling, Nunatsiaq News. For the recent Baffinland Nunavut Impact Review Board meetings, did technicians who came up to facilitate the meetings in Pond Inlet and Iqaluit, did they have to isolate before entering the territory?
Megan Dooling, Nunatsiaq pivalliajukkunni taakko Baffinland ku nulujani Nunavummi avatiliriyikku katimatitautillugi tamakko suurlu waajallirijingi dubbalu haqisaujallirijingi mitsumatalimmursimayut inutugia haqtitaukainarsimavat tamaanilluuni iqalunni tikilaunginninginni tappaani.
No, they didn't. The feedback that we got was that without those technicians, the meetings could not go ahead, that there was nobody in Nunavut who could do the work that they did, and that isolating for 2 weeks was, the NIRB would not have been able to get staff who could isolate for 2 weeks.
Agga taakko inutukainnaqa haqtitaulaungitu tappaunga tikilaunginninginni taakko uqaujaussimalauqatta taakko kamayingit katimane kayusigunnalangalauнгиммаггу taakko tikingippata taimaimma taakko maqquni pinasaaqusiinni taakko nunga Nunavummi avatiliriyikkunnu iqqanaajartinginni atuinnartaqalaungimma taimaimma taakko tikititaulu tikissiani katimagunna qayalaungata.
And so what advice did the Public Health Office give them in terms of cleaning the things that they touched and interacting and wearing masks and stuff like this?
Taanali anna hannangittulirinnermu allabbiin hanu malittaugalinni tilisigutikhalauqqasuurlu salummarsainginnahattahullugi attortalimaanginni kubbalu katisiluattailinnermu hanu tilissimalaoqqigi.
We reviewed the general infection prevention or COVID control plan that the NIRB forwarded to us, and those workers got the exact same, they had the same requirements as every other exempted worker. that they maintain distancing and separation when at work, and that they isolate themselves outside of work hours.
Thank you.
Takwa himek pula watigo takwa katimala tilugi parnau tigi yang inuvajuar nak tumisar matayunitit sinar mo parnau tingit takwa kana yakti tay matsay nak maligay linginik takunong inututay inutuga haptitaungit tunek kana yaktinot sulu tay matsay nak maligay kalautut sulu imiko kaswas limay nakluti kana yak nak miniyam malo anit tay lihat takluti kana yak nagunirayma.
Emma Tranter, the Canadian Press. What has the contact tracing, the rapid response team learned about where this case originated, or have they learned anything about that?
Emma Tranter, takwa kaya saktaw si mayukik kuni katisin ng mga takano kaya si mabanakingang ng mga.
Nothing definitive yet. It's probably, at the end of the day, linked to the first 2 confirmed cases from a couple of weeks, 3 weeks ago, but how that happened, we don't know yet.
Gasolina lo na ito sa mga ito kasi ito ka nga nakatuin na realita ko sa bulak pa may makko nalo na ito lo sa mayo pingasulak ti pinaswa ko sinasimalak ti kasi nalo na ito sa malaking ito kanok nakisa mabiw ng mga ata.
And because some of these individuals were symptomatic, how likely is it that these will come back as false positives?
Tako hanu iguti hatu ya nirataw lang yung mata tako tamak si matuid na kaya mga ata kaya sa kutingit isumabi.
I can't say 0, but really unlikely. Having 2 confirmed positives, now 8 presumptive positives, and a few of them having been symptomatic, and have all of these extra 8 turn out to be false positives would be, the chances of that happening would be vanishingly small.
O karon nang ito nga tayo mga kanulata ito ka nga nakakayangin mga ata tako makbo nalo na ito lao tilugit ang malusita mauyok to tako siyang makbiw si manirak tao tilugit si bulak pa siuti nalo na ito si matilugit tako alo ilang ikano iguti hak tilugit nalo nang ito tako tamak si madangit nalo nang ito tamak ko ilang nalo na ito lang ayun uwadyo ang maktukang ningin ni.
My next question is for the Finance Minister. Minister Hicks, one of the best tools that the government has had for preventing COVID from going from a mine site to a community is that Nunavut-based staff have been staying at home and earning 75% of their wages. Have the mines given you any indication how long they're willing to continue that program for?
Mr. Hicks, tako pilirijutit siya ng napango sa mata uyakar nerbe mo to nunalin nga tunit ikananya kaya biuhat tangin mata tay masya maktayli titaw si mammat ang maluno na vumiw ikanayak tiyo galo ikanayak at tangito 75% inikinaw dyan sa inikinaw dyan sa lutik kanutigita ko yung nerbe nalo na si mabata kanutigita man na kayo sinar mga.
Thanks for the question, Kent. I know Minister Akiagak is more engaged directly with the mines. I do get updates from a couple of the mines when they do their extensions of how long they're going to continue paying. I can't remember the dates that they, or the chunks of dates that they go into, but I know I, for one, am very appreciative of that methodology that they're practicing right now, and I realize that, like our own costs, it's not something that can go on forever and ever, amen type thing, but I do. I'm sure I'll continue to get updated. I don't have a timeline, and they haven't specified a timeline to me.
Kuyan na may kantan na minister ako yung nabin ni pilih hati ham naksaw hatak tu galo kasi ni tako makpo yung nabi tu sabi hatak takalo abu kanutigi akilak singin ng mga takinaw jet sa kaya unik tako ako yung itsa tako tako suli kinaw jet sa ngin nakilak singin mata Tabong alima kilik sui jay gunda jay yutsaw ito galo kasi ni nalo nang ito tusak kita uga kat lang ayo.
Premier Savikata, during your statement, you mentioned towards the end about all the steps that Nunavut need to take in order to keep up best practices to avoid contracting COVID. I'm wondering, are you going to be taking your plane back down south for the winter? And if so, what is your plan for isolating when you return?
premium savikata takwa kanile rote galinne balita galinne Nunavut me house hakka bitama no va joana tike khunago hangata yoge jaita na kyoku tawno haluna no tikanila khyo kamalo hano parnasimabe.
Thanks for the question. Yeah, the plane will be going back south, and the person flying it will do the 14-day quarantine.
Inutit.
Tāna ting me hoa kapdunanun uterner, tāna kangataya endak. Taunung agyak taulun tāna kangataya ting me hoa te taun 14 days inutu hu minakni ama wangaulang isuni. Just actually, I won't be piloting the plane. Thank you.
Jackie McKay, CBC News. Minister Hicks, please. CBC's been receiving a lot of photos from people in isolation hubs of moldy food they're receiving in those hubs. What is the government doing to ensure that's not happening?
Jackie McKay, CBC Kunik Minister Hicks tako go CBC ko jingoani tako titaw hatangata tuyo mevenne neriyaw hatatoni ukhsimayoni government ko hanuiliog na khatamatumong.
Thanks for the question, Jackie. And I saw a couple of the pictures that were reported, and frankly, it's unacceptable to provide moldy food like that. We have been working really hard to give people some choices and some options, providing country food with regards to the quality and sometimes how long before the food is delivered. We have had meetings with our staff, with the contractor, and with the general manager of the hotel, and they've put in additional quality control measures so that hopefully this won't happen again.
Tana tao tay kuninga jingoani tako simameyok ima nakoyang natsertunik kisani tamana tay mega hangilakimat nalira ko tikakti tao hatak to surlo inulertaning atuid na viulutik ambalota ko kaningi kalo mga taniriyaw nerto nalo na tao tsak asokan ng nalak to katima kataw simalutik contract tax simayot ambalo to yung me manage nga.
Dr. Patterson, please. The NWT is considering bubbling with the Atlantic provinces because we're bubbled with the NWT. Is that something we would be a part of?
Luta Patterson tako nunat sermiot ima aula hatta hatigi gasawang nalang kata singin na kalunani tunik aula hatta bigi guna katigulu nunat sermiot taman na kano ato ini kamna kawatino.
If the circumstances were right, yes.
Tay ma kano ingit ser ka kano igigayang itaka.
What can you clarify what those circumstances would be?
Well, I'm sorry.
Oh, nalito kisiya tikay nanga kano kisu sakit to kang kisu ni.
I'd just like to note that after 8 months, I finally had to remind Uli, not the other way around. That's a big deal. Sorry. That the cases stay low as they are, and that they continue to maintain their side of the bubble. And the last question is how we work the logistics, like how do you get from Atlantic Canada to Iqaluit reasonably safely? If we can work out all those logistics, I would support it. So it's in discussion, that's all I know at this point.
Apas ilahat sinaw to akatano ka joanak ta simayot tamakwalo taunani sang mapalya ngito akata kanolo akitaw si manang ipam na taw si maningit surlo kanataw kanan nang iningato tamawe kalunno kaswak tilugit pang na taw si matsak pataman na ikayok surayak ta kisani man nakakatigi ko taw valayok sule.
Mathieu Sarvé, Radio Canada. At the previous media briefing, you said you were considering to bring up positive swabs from down south in order to get the certification. How far are you from that option?
Mathieu Sarvé, Radio Canada kunita ko ismasasyo ko hamne kayo gabitamak ko kayo sa ko tiyo hatak to kalunano titaw gato dangin matar kano tigi taman na kayo sa ko tik so itaman ato na lakan.
It's been discussed, but it may not be necessary the way things are going right now. The criteria for saying that we no longer have to send south for confirmatory results is 15 positive and 50 negative. Of the 4 operational devices in Nunavut, we're at or close to 50 negative for all of them, at or close to it. And we have at least 10 positives right now if they all get, or up to 10 if they all get confirmed. So we'll see how things look after this outbreak settles down.
Tamakko suli hakata valle mata suli aulaqtit sakata hakata khalluna kisani naluna tautsa kanne khullugit aulaqtit hakata harunni laartu taakko khawyisarutingit 15nik naluna sisimalqatan nuvajuarnartuhanginninginnik ammalu 50 kannernik nuvajuarnartuharninginnik naluna sisimalqata taakko sitamait aulata yohawyisarutit 50 yung ataanossimalertu tamakko nuvajuarnartuhanginnerartaujut kisani taakko hulirutuinnareali taakkununga naluneertauju nuvajuarnartuharningannik taakko tikiutini usangittu suli 50 no aippanga naluneertaugutinga nuvajuarnartuharutauningani.
Thank you. So just to clarify, is it 15 minimum per machine, per device, or total?
15 or 50?
50 negative, 15 positive, and that's for each device.
50 ulutik nuvajuarnartuhanginnerartaujut ammalu 15 nuvajuarnartuharnerartau patay mataakko khawyisarutiin naloqqutigunnernerartaugayartu.
Megan Dooling, Nunatsiaq News. Why are you saying that exempted workers have to start wearing masks outside of the house now?
Megan Dooling Nunatsiaq taakko inutugaha kay narsimangnitu qanayaqarsimayu tamaunga summa uhastasinnaaleqqimaanna matuarsimagaaqalerningini.
Because the risk is rising as the numbers return again increase in the south, and because there's some confusion and just some people who don't want to follow the orders and look for loopholes, so we're making it as clear as we can.
Upinnaaqani tamakko auluqaanaq sivallealerngat ammalu amisungupallalutit nuvajuanartuli qallunaani tamanna naluliqutauqattarsimalaungaat ilangi malitsiaqattartuugaluat ilangillu malittailinermik qanu malittailigunnarmangaamik qawigasuaqattangata tamanna tukisinartigialagiattuinnartaputa imaamatuarsimainnarinnaqattariaharninginni.
How many people came up to facilitate the NERB meetings, and how did you communicate that to the communities that they were in?
Qatsiulauqa taakko nunavummi avatilirijikkunnu katimagiartu tikititaujut ammalu qanu taakko nunali tusartissimalauqhigi tikibbiulaarninginni.
I don't have a total number of people who entered the territory. I know that some isolated, some were in Northwest Territories and already in the bubble. And there were the 4 individuals who were approved for exemptions for the technical stuff. And there was communications with the communities that we had reviewed and endorsed their infection prevention control plan.
Qatsillattaangum mga taqauyamangittunga tamaunga nunavummu tikilauqtut ilangit inutugaaqakainnartitauqattalauqtu sivungagut ilangillu nunatsiarmiingaalaorsutik taakkua sitamaat ima katimayuni aulatsigiartorsimayut ikajoriartu taakkua angertaulaortut inutuukainnariartutitaugatik ammalu parnautinginni nunali taakkua tusartitausimalaortu tikittuqalaarningani.
I'm a transfer of the Canadian Press. 2 days ago, the Prime Minister announced that the federal government will be purchasing these rapid testing machines. Will Nunavut be getting any of those, or could we use those at this point?
I'm a transfer, Canadian Press. Kunnik. Taakko government-qakkunalunersilaungatta taakko khilamiujukku khawissaqutitsauju nunavummi piqataulaaqa taakkununga khawissaqutini.
Yeah, I think we will get our share of the our Nunavut share of that purchase will be made available to us. And the devices themselves, they have their uses. We just got to figure out the best way to use them in that's part of our overall system.
Nalo nang ito pikataw lakto government hakuni ngatunik Nunavut tako Nunavut taw sa mayon pikasiu jaw lakto tako hawi sa kutiyo yu kano atorun sila mga tigo amalo kano akaw nang nakpako atula mga tigo suli nalo na kalakta.
Can you give us an update on the pilot project on testing? You were using charters to bring tests here to Iqaluit. Can you give us an update on that?
Kau tiga aku nak ketiga ulu memang ilak mengata na utu kau tilu nak kau isak tahu lokto hangat tadi tahu yuk kanu tiket itu sehat tam nak mengat si kau isak sani.
Yeah, thanks. It was actually very successful. I think for the 2 weeks, all but one of the lab sample shipments got to the lab in Iqaluit within that 72-hour window, and most of them were a lot less than that. And so we're going to continue on with that, and we are going to expand it to have a plane in Rankin Inlet serving the same purpose for Iqaluit and Kitikmeot.
Taman na kayo sinahat sa atong makiulaw to dako na ni makaw ni pinasa ako sin ataw sito tan na kayo sakat sa yo kayo sakbi mo palyayo kalon no kingo vaksimalawak to ila ikakani 72 ni tikigun naksilawak to dako asingi tikisakay nak sa palo katalawak to taman na kayo sigo tiginak tabot amalo atoy na katala ngayo hanga tayo may kang sinak me tay maulak titagun nak to may kiban lang me kitang me nilo.
Jackie McKay, CBC News. Just to clarify on Emma's question, the BioFire machines, so are those up and running for the territory now?
Jackie McKay, CBC Kunik tako kau isa ko tiyo BioFire tako aula ne katsala katamani.
Yes, both BioFire, Rankin Inlet and Iqaluit have both a BioFire and a Gene Expert available for use.
Tako tamaki kang sinang me halon nilo tako atoy naulak taula ne katsala sutilo BioFire amalo Gene Expert kau isa ko ti.
And is there any recommendations for Nunavut for getting flu shots this season?
Atuloy ko yung simavino na vumeo tayo kanimanang ito may kapayaw katakulugi.
Yeah, we want everybody to get their flu shot this year. Everybody who can. The flu shot will not protect against COVID-19, but it will reduce the symptoms that are, hard to tell. If somebody starts to get a runny nose and a cough, it's hard to tell without a test if it's flu or COVID-19. So preventing that is a good thing. And it also, if everybody gets the flu vaccine and it reduces the burden on the healthcare system, then it frees up staff to deal with COVID-19. So it's an important thing to get done this year.
Kikulimat sa na vumeo kapayaw gali tamat tuminga kanimatay linaktumik tan sa pumiyaw gudna jang ito galo no vadjo anak tumut kisiani kanuingin aksaw laki gutaw gunangat dalo na kayang atay ma kanimatuin ng mga ata o balo ni no vadjo anak to ham mga ata kisiani kikulimano na vumitay ma kapayaw patatay ma ana ham nang ito ligit piyat sa hang naksaw gayang ata no vadjo anak to liringar naksaw gunangat tamay ma
Just a follow-up to that, because people are supposed to be avoiding going to their healthcare centers in person, how should people get their flu shots?
Each health center will be able to set that up for what works best in their community, and it may mean either clinics outside of the health center or set periods, set clinics, flu shot clinics. So there's a variety of options available in each community.
Atuni nunalid ni anak biyo imini akit sigo nakto kano akaw nakpang mga sulan na biwilo ni ugi atung ito kapayaw katang nakto hangakuna mga kitsigunakto na milu kapiyaw hatakto harna mga singin naliraro to haronakto.
Ken Friscoli, PTN National News. This might be the least important question you take today, Dr. Patterson, but I've been asked to ask it. Are we going to be able to have trick-or-treating in Nunavut at the end of the month?
Ken Friscoli, PTN kumnita na pimarayong inakpango yutsoya perinartara pero huyaw si mambago tako Halloween utilugi humiagarnik ima pularaw to haronalakan.
It's an important question. It's maintaining normal life for our children, which is what I think most of us want or consider a priority. And so, yes, we trick or treat, as long as things stay the way they are, it's safe for trick or treating to continue. We will produce some guidelines, and including for communities like Iqaluit, allowing for decisions to have some degree of indoor trick-or-treating so that we don't put kids at risk of polar bear attacks.
Dan nalipin Mario ya pekutigi ya tay ma surusi pero palaning in kano itele kuna ratigo. Pula hatta kuna lang ayot at tanang nito akat takwala kitsena ato agam ni malitaw galindik surlo avami ismali rota hatta lang pingwa beilo ani tay ma Humegang nito niyo kaktaw katak sutik solo nanoktaw niyang matatay matag pangnaw to hakonak to nino nalay.
But just to be clear, that's assuming that there's no worries about transmission of COVID-19 in a community. So we'll keep our fingers crossed that we can stay the way we are for October 31st.
Tay ma isamanak to tako ser maksimayo hang ito akano Nunavut ila. Novadyo abdak 19 mi tay ma isma gintuin nam na akta po tay ma ikaw nago October 31 ngulakat.
Yeah.